Hello, my name is Shivanie Sharma, and let's talk about excess body weight and its association to diabetes mortality.
Diabetes is a chronic metabolic disease that affects many populations. According to the CDC, there are many different types of diabetes, but the three most common forms are type 1, type 2, and gestational diabetes. But what can cause diabetes mortality? By utilizing the Florida health charts, we can examine the frequency of diabetes mortality rate in Florida by Number 1, person. In this graph, we can see the diabetes mortality rates for Florida blacks versus whites over time. We can see how diabetes mortality is clearly a racial disparity. Number 2, place. In this graph, we can see a map of Florida counties and the distribution of diabetes mortality by age. The top 5 highest rates of diabetes mortality are found within rural counties. And number 3, time. In this graph here, we can see how diabetes mortality has changed over time. The mortality has remained relatively constant with a notable increase in 2019.
This tells us that these two factors might be related to the risk factor of being overweight.
This leads us to our research question and hypothesis. The study aims to examine the strength of association between diabetes mortality and being overweight. It is hypothesized that there will be a positive association between being overweight and diabetes mortality.
For the first part of the methods, a correlational analysis was conducted.
Correlation coefficient of negative 0.338 was obtained, which signifies a weak negative association, which is what is shown in the graph. A p-value of 0.005 was obtained, which shows that the association is statistically significant.
For the second part, an epidemiological literature review analysis was conducted, and 3 articles were selected.
The first article looked at the body mass index, diabetes, and mortality in French women as a paradox. It was a prospective cohort study that used a hazards ratio as the method of association. It found that mortality decreased in women with diabetes as BMI increased.
The limitation of this study, however, is that the confidence interval is statistically insignificant. This is because the value of 1 is included. A hazards ratio was used for this study, which has built-in selection bias. But it is also difficult to interpret the causality between the variables using this method. So this is why the results may have shown insignificance.
The second study looked at effects of intensive lifestyle intervention on all-cause mortality in older adults with type 2 diabetes and overweight and obesity. It was a randomized controlled trial that used a hazards ratio as the method of association.
The results conflict with the results of this study. It was found that the mortality is not significantly impacted by weight loss. However, weight loss and lower mortality was supported relative to the diabetes support and education.
The third study looked at overweight, obesity, and risk of all-cause and cardiovascular mortality in patients with type 2 diabetes mellitus. It was a prospective cohort study that used the risk ratio as a method of association. It was found that excess body weight may be a protective factor for all-cause mortality. Conclusions. This study provides more information to the controversial obesity paradox, where we can see an inverse correlation of being overweight and diabetes mortality. A possible explanation is that we can see increased BMI associated with diabetes prevalence and incidence, but diabetes mortality and morbidity associated with vascular and non-vascular disease development. Implications. Employing health interventions like better access to health and medical resources and education may help combat diabetes mortality and morbidity. This is related to the second article. Weight loss produced results because it actively had effects on the participant's body. For diabetes education to have an effect, the participants must include changes to their lifestyles and daily habits.
In short, diabetes is a complicated disease. And the controversy surrounding the obesity paradox doesn't make it any more easier to understand. However, this study provided results that show that excess body weight doesn't really have anything to do with diabetes mortality. Diabetes has its own risk and consequences. For this reason, it is crucial for a person with diabetes to become educated on the condition to avoid mortality and morbidity associated with the disease. Thank you.